Hi, all. Thanks so much for watching. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we're talking about our interview with Dr. Connie Guille, who is the professor and director of Women's Reproductive Health, Behavioral Health Division at the Medical University of South Carolina. And this is part of our ongoing series. We do one a month with the Medical University of South Carolina because they have so many amazing innovations. And this one actually reminded me a lot of our last interview with them, which was with Dr. Bessem Ogretman and the field of lipidomics, which we became really fascinated with. And so this one was perinatal psychiatry, which is another field that people probably really don't know a lot about, but it's an incredibly important emerging field. And so she was telling us a lot about things that they're doing, from better detection to working to determine the social determinants of health of people who are coming in. And then also a perinatal psychiatry access program that they have, which will allow people to make a phone call and get connected to a psychiatrist, and then who could potentially refer them to other professionals within 30 minutes. And so it was very much about proactive action, making sure that we're identifying the people that are coming through. And then she also was saying how important it is when women are pregnant, that a lot of times when people are pregnant, they don't have medical care before, or health insurance before that. And so during that year, when you're seeing them throughout the pregnancy and the following year, she said there are about 26 touch points that you have with them. It's a great time to be able to assess all of the things, from, just their blood pressure to their mood to all the other things, what they have available at home, what other resources they may need. And she was such a passionate person, sharing her story about why this mattered to her and how she knew she was going to go into psychiatry and women's health. And then after having her own children, she realized how very important her work was. So just another great interview with somebody who is so passionate about the field that they're working on, working to make an actual difference in the lives of the patients they're serving, and all kinds of different innovative programs. I love hearing about the programs that she's working on, because it's really great. And there's an infusion that can help with postpartum depression that we didn't even get to talk to her about because we quizzed her on everything else about her field. But it's a pretty cool 60-hour infusion that people with postpartum depression can get that makes an immediate result and has a positive impact for at least 30 days. And so just one of the many innovative things that they're working on. Apoorv, what stuck out to you whenever we were talking to her?
Right. I'm listening to you speak and I'm thinking, what did we not cover? And yet there was so much we could speak about, so much more we could speak about to fill additional sessions. I think that the framing she set for her field really, called out to me. Basically, the point she was making is that there were case reports back in the 1800s of women suffering from postpartum depression. And then the field grew slowly until the last 20 years and probably the last 10, where she's saying it's just really mushroomed. And there's, luckily a lot of people wanting to go into the field and more research. So unfortunately, probably because the challenge is continuing to grow, there's a lot of women who need this support. But on the plus side, there are also people recognizing it and wanting to go into the field so that they can offer their help and services. So just like you mentioned about lipidomics, the field, probably in the works for decades, but only really hitting the scene recently, so to speak, when it's become mainstream and more people are hearing about it. I think that's what perinatal psychiatry speaks to me of. I think that this is an area that is going to only continue to be better understood, better communicated. Hopefully more people will be talking about it. That was a key message that she articulated when we talked about how difficult must it be to reach the people that are impacted by it, given that they may only be impacted by it over a short span of their pregnancy. So her point was, well, we've got to just spread the word and get the conversation going and have more people talking and thinking about it, so that when the time is right, that an individual may be able to get access to the services. So that I think was very enlightening as well. And then Stephanie, your story of you're saying to the day, This is the day 6 years back when your daughter Kennedy came home from the NICU. And at that time, you were referred to Dr. Gill potentially. You didn't get to see her, but you were almost on the verge of seeing her for the kinds of services that we're grateful that she's able to offer. And just recognizing how there are so many different therapies that you can be accessing, women can be accessing throughout the course of their pregnancy that can help them maintain their health and their mental health. So I'm really grateful that you shared that story with the audience. And I'm hopeful that those women in the audience that are listening to this will keep in mind that there are great resources available to them if they should ever need when they're going through this really incredible process of becoming a mother or becoming a mother again.
I will say that I was fortunate. I did not have postpartum depression. My issue, if you listen to the full interview, will be that I had anxiety around monitor watching and, how do you take this baby who just needed such an extreme level of medical care from, round the clock for 3 months and then take it home. And it's like, there's no nurse. I have a degree and, a master's in broadcast journalism. What the heck do I do with a baby on a heart monitor? So it was around that kind of stuff, but I was able to find solutions, like you mentioned, for myself, creating a mantra and just really trying to focus on those types of things that made a difference for me. But one thing that I've consistently seen through my own personal care at MUSC is that they always refer you to the next level provider, the best provider for you. So that I got referred to Dr. Gill, potentially. Again, I didn't end up contacting her because I found my own solutions on my own, thank goodness. But I was very lucky that my daughter's neonatologist did refer me to her, because she was, obviously she's excellent at what she does, as everybody will see when they watch this interview. And throughout that, I also was in contact with a nurse line, and there's so many other things that MUSC never misses a chance to refer somebody to the higher level provider in that specialty. And I've always appreciated that. And so it's hard to imagine that with the great work that Dr. Gill's doing and all of the other people at MUSC, that they're not going to have such tremendous outcomes, because they do not let people fall through the cracks. And I really appreciate that.
What a powerful testimonial. That's excellent.
And thank you all for watching, and stay tuned for the interview with Dr. Connie Guille on Thursday. It's great. We'll talk to you soon. Bye-bye.
Bye-bye.